everyone. This is Nurse Sam and Dr. Beth of Sleepy Dog Veterinary, and today we're going to show you a live stream of Burton, aka Mr. B, who is coming in right now. Let's see if I can flip the camera of Mr. B getting some acupuncture. Are you so excited, Burton?
All right, Burton.
Okay.
Now, typically we take off all our harnesses and collars, but as you can see, Burton needs his for an assist, so we will wipe everything down at the end.
Yes.
All right, so are you ready to lie down? He's got to investigate some things first.
Yes.
He's still getting used to being without his mama in the room.
Yes, and we make sure we do all our treatments in the front room now so owners and pet parents can see what we're doing in here and say hi to their animals.
So we're going to take this off, which is often described as a life changer for dogs.
And that is
a harness. Sorry, Sam.
Nope, it's okay. I was just going to say it's a help 'em up harness.
He knows where the treats are, as you can see. Liver right there.
Oh, yes.
So first thing we're going to do is we're going to start with, make sure this is out of your way, sir. Start with an exam. All right. Sam, am I right in your way?
Nope, you're totally fine.
There we go. Good stuff. So Burton is a senior Leonberger. He is the best guy ever and struggles with some arthritis and also some digestive complaints and some neurologic ties to his digestive problems. There we go. Look at those gorgeous teeth. So he is our largest patient, right, Sam?
Yes.
One of the kindest guys we know. Very patient. Loves children. Children love him. He loves hugs. So I'm just going to feel all his joints. See what I can feel under all this fur. Oh. Oh. And he also loves Sam's massage as well. But during these times of coronavirus, we're limiting our massage just because it mobilizes so much hair and dander and germs getting in there that we're going to be happy with acupuncture, electroacupuncture, and some moxa. There we go, handsome.
And what are you doing now, Dr. Beth?
Now I'm actually feeling for different acupuncture points along the spine. The acupuncture points along the spine connect to different meridians and tell us different things about the body. So I'm doing those to kind of see which parts of him, which meridians or channels that reflects the organ systems of the body need a little work. For Burton, it's often his spleen meridian, which controls kind of this is all from Chinese medicine, but controls the way the fluids are processed in the body. And Burton often has a little bit of trouble with that, which leads to a bunch of dampness. He's also a hot guy because of his coat, but also because of his temperament. He is definitely what we would consider an earth temperament in Chinese medicine, which is really lovey, cuddly, sometimes tend to be chubby, sometimes not, really caring and nurturing. But he's also got a little bit of fire type because he loves to be the center of attention. And Sam, remember last time we were treating him, whenever I opened up my computer, he would get mad at me and make sure that I wasn't typing.
Yes.
He wanted us to do that. As you can see, he's got his eyes on his mind. Let me just close this just for a second. Here's our So Burton also gets chiropractic care from a fellow veterinarian, and also gets cold laser with them as well, and has a bunch of doctors on his team to help him stay as healthy as we can keep him, which is pretty good today. All right, so next I'm going to put in some acupuncture needles. Want to check those out?
Oh. Sorry, my phone is yelling at me that I can't rotate it.
He's too tall. So most animals do not object to acupuncture needles. Some do, but for the most part, they're pretty well tolerated. Burton for sure has been tolerating them for many moons. And so what happens is you can kind of think of acupuncture as working in two different ways. One way is the old traditional way of thinking of it. It comes from Chinese medicine. So someone, somewhere, for some reason, stuck someone with an acupuncture needle or some kind of needle, some kind of pressure, and it led to some repeatable things. So around the things that they were observing in these olden times, thousands of years ago, they kind of developed this paradigm of why acupuncture worked, why herbal medicine also worked, and things like Tui Na, which is a form of massage. And so it all centered around Qi, which was translated to be kind of the life force of the body. And this Qi flowed through channels or meridians over the surface of the body. And that's how we could get into the internal organs and affect change there. So for instance, there's some acupuncture points along here on the inside of a dog's leg here for us that have to do with reducing nausea. So all these things, all different areas of the body can be affected. And all these acupuncture points are based on the anatomy of the animal or the person. So that's what I'm feeling for when I put them in, is different bony bumps and muscle bellies and things like that. So by stimulating the acupuncture points on acupuncture meridians or channels, we can affect change in the body. So for him, I'm using this point here, which is bladder 17, which is called the influential point for the blood. Anytime someone has arthritis, it's generally thought to be an imbalance of the blood and the qi not moving super well in the body, so we want to influence it to move more smoothly. When we have compared how acupuncture works in a Western medicine model, we found that there are no particular cells that are present in acupuncture points, but there are different proportions of cells and a different electrical conductance in that area of acupuncture points. And if you stimulate them by placing a needle, placing pressure, using cold laser, all sorts of ways, you can in some ways change the surrounding area to reduce inflammation, promote blood flow to the area, healthy blood flow. You can also have little neurotransmitters, little messengers of the nervous system go up to the spine and also go up to the brain. And you can tell the body to stop listening to the pain sensations that are down below. And you can also tell the brain to release some of the body's natural endorphins to help with pain. So because Burton has arthritis in many joints, we're working on trying to reduce inflammation and reduce pain. But because he also has some digestive issues that have to do with the motility or the movement of his gastrointestinal tract. We're going to try to work on that too, because acupuncture can also influence those things as well. Any questions, Sam? Anything that I haven't touched on?
I don't think so. The only thing I was going to mention was maybe about a minute ago, Burton just did a big yawn, which is a great sign that what Dr. Beth is doing is causing a nice release of his energy.
Your mama's still out there, don't worry. She's giving him a nod, telling him it's okay to lie down. These two are soulmates, aren't they, Sam?
They are.
You love that mama, huh? So this has been a big transition during this time of pandemic for a lot of our patients getting used to having their parents not in the room. And we don't have all our cozy stuff that we usually have. So Burton's too big, I think, for our beds usually.
Yes.
Two of them anyways, but we're all getting used to it. Making sure we get our pain controlled, right, Burton? And one of the biggest challenges with Burton is finding the needles after he's done because he hides them well. And as you can see, it's good that I do my yoga practice.
Yeah.
Right, Burton? Alright, I'm going to put two more in his legs, right? And then we're going to hook you up to a circuit, which means we're going to do some electroacupuncture for him, which I will show you shortly. And then we'll get out some moxa so we can get some extra zippy stuff for him. Alright, so oops, try not to lose my computer. So this is an electroacupuncture unit. There's many different kinds. This just happens to be the one that I have.
And when would you use electroacupuncture?
I tend to use electroacupuncture in situations where I'm trying to give a little bit more oomph, particularly in the spine, to my acupuncture. It depends on the kind of training that you have. Dr. Lou probably uses electroacupuncture a lot more than I do. Wouldn't you say, Sam?
Yes.
Yeah, so depending on our veterinary training, just depends on how, I would say, often we reach for these things. But there's definitely been a lot of good studies in dogs, and people for that matter, about the effects of electroacupuncture on things like intervertebral disc disease, and I think it can be really helpful in arthritis. I think Burton's mom requested electroacupuncture at one point, and so we tried it, and it definitely has helped. So what I do is I'm connecting these leads to the acupuncture needles that I've already placed, and then I'm going to turn on my unit. I'm going to turn it down so it's not too far on. And in my training, we use a system we have it on a setting called dense and disperse. So we go from a low value up to a higher value, so that the thought is that the body gets used to one for a little bit amount of time, and then you go back and forth so that the nervous system kind of has to work a little bit harder. And while I learned to turn it up to the point where you see your patient respond and start being twitchy, I don't actually do that. I usually keep it lower than that. In people, we can say this is something that is for your own good, and we want to keep it to the point of like just tolerable. But in animals, I just feel like we should keep it at like only a comfortable level. So I will switch now with Sam, and I'm gonna have Sam do some moxa. I'm gonna keep an eye on the time so we know that he's not overcooked. Okay, and then Sam will do some moxa, and we'll talk about the uses of that too. Alright, let me just make sure I don't pull anything out. You might have to give him your hips so that he has a nice thing to lean against.
Where?
I want to do his moxa today around his knees and around his kidney belt. So the kidneys, in Chinese medicine, are in charge of the bones. And so we're going to stimulate them a little bit. Also, we know he has some arthritis in his knees, so I just want to give those a little bit of help now too. So Sam is preparing this moxa, which is actually, there's many different kinds of moxa, and this is a little bit new to us because it's a Japanese style and it's really nice and smooth. A lot of people complain about moxa being very smelly, kind of like the smell of marijuana. Oh, she's not gonna leave, I promise. She won't. She says, I just love her so much. So Sam is getting it smoking. So moxa is, the full name is moxibustion, which is the art or the science of applying moxa to a body. And it's actually an herb called mugwort that is packed into those little cylinders and is then applied to the body. In people, the traditional use is to have, oh, you're perfect. The traditional use is to have the moxa, the little pieces of moxa burning and applied and kind of let to kind of smolder on the end of the needle. Clearly, with this handsome friend, that would be dangerous because we don't want to light any fur on fire. Oh, that feels good, Sam. And so this kind of new system that our colleague, who's a people acupuncturist, turned us on to is nice because it keeps the burning part. Sam, will you just lift it up for a second so you can see how far the cylinder is, so it's not going to touch his body. And then also you have that kind of little napkin-like thing that is also protecting it. So she's kind of getting a sense for how warm it's getting. This type of moxa does not smell as much like marijuana, but I don't know. We think it smells good here, but I don't know. It would be up to you to judge. But so what happens is the moxa and the heat of the moxa goes into where the needles are placed and into where the acupuncture points are and is taken up into the body. And the body can take advantage of the moxa properties through this way. It's a nice thing to do in the colder months, but it's a nice thing to do also for arthritic joints. Sam is doing the kidney belt, which is a series of acupuncture points that stimulate the kidney, and so we're doing that for his arthritis.
And why would we stimulate the kidney point for arthritis?
We would, great question, Sam. We would stimulate the kidney point for arthritis so that we can nourish the bones and nourish the joints, because the kidney is telling them what to do. The other parts that we're going to do next, see if I can go around. Let's see if I can show Mom out here. There's his handsome face. There's Mom out there. He would prefer it, I think, Sam, tell me if you disagree, for us all to be in here together,
Yes, I think so.
talking about him and how great he is, because he is that great. All right.
Alright, shall we move on to his knees?
Yeah. Shall I come around here? All right. Mr. Burton. Then we better get you some cookies, huh? All right, so Sam is now working on his knee. And so that open end of the cylinder is making contact. And Sam is trained in acupressure, so she knows where the acupuncture points are. I'm going to guess she's doing points called Dubai, which are kind of on either side of the patellar ligament, so right kind of in the center area of the knee. And I'm also going to guess she's going to go do stomach 36. Oops. Here you go, sir. And probably another point called gallbladder 34, or she'll tell me if she's doing something different.
Oh no, you know me well.
These are some of our faves. And as you can see, Burton is still most concerned about watching his mom, but not too concerned. Oh my gosh, look at that handsome face. Probably one of the coolest breeds ever.
Agreed.
Oh my gosh, they're so fun. She's just checking to see where she is in space, making sure nothing's too warm. And probably after we do this one, we will go to his other knee, and then we'll probably give him a break because I feel like he's just run so hot, just in case it's warming him up a little bit.
Okay, let's get that other knee.
So this one might be a little bit harder to see just because he's tucked under there, so she's going to use her hands to find where she is.
Here, sir.
Tell me what I can do to help you too, other than...
Oh,
Look at those long legs. Oh my gosh.
there we go.
And then Sam, how about after we do this, will you do those compressions for him?
Yes.
So even though we're not doing a bunch of our traditional massage, Sam has been doing some of her massage treatments and techniques that can help with different types of pain and tension that mobilize a little less.
Ooh, that box is heating up today.
Just another quick check on this handsome face.
Okay, one more.
Burton has been known to come and sit on our stoop and demand to see Sam because he loves her so much.
All right, sir.
All right. So she's putting it out because safety first.
All right, now we're
Okay.
going to do some compression. So Burton carries a ton of his, most animals, well, I should say. Where are you going? All dogs carry most of their body weight in the front of their body, but if they have any hind end weakness or pain, they're definitely going to put even more in the front. So I love to focus on their shoulders first and their neck for compression. And I'm kind of just using the heel of my palm to go in and slowly come out, rotating where I am. Careful to avoid any needles right now. And then Burton has such a big neck, I can actually do the same thing up in his neck on either side. Avoiding his spine though, because pushing on any type of bone is pretty tender. And I'm kind kind of using my fingertips too, just to really kind of give them a nice release.
And typically in our normal setup, I think this is his favorite room because it's the biggest room. But usually when his mom's in the room, he is laid out flat, so enjoying his massage. Oh, some bikes have gone by. That's exciting. Here's another scooter, Burton.
Then I kind of move down to his triceps, work on those, because everything is connected. So if he's holding tension in his shoulders, his triceps are going to also need some love. Biceps. I'm also going to go down and work on his wrists a little bit. I know. Hi.
Getting a lot of comments, Burton, about your handsomeness.
Just doing his other triceps right now. I'm going to kind of move behind his shoulder blades now, where he also tends to carry a lot of tension.
She on the right track, buddy?
And now I've switched up to a technique called nafa, which is when you're kind of picking up the muscle, the skin, and the fascia off the body. And that can be a little bit more gentle and releasing any muscle tension or spasming. And he usually responds pretty well to that.
That feels good. That's a lot of body to carry around.
Also going to do that along his spine, avoiding his needles still. I don't know if you guys can see that, but that's a pretty big area of tension, and he's got some spasming there when I do that. Boy, Burton. Do some compression too.
Looks like he's smiling.
And the important thing about massage is you want to massage even the areas that are not technically the most painful or most tense, just because they need circulation to get back there in order for better pain relief to occur. And you want to stimulate those areas so that those muscles keep working and keep moving.
Oh,
Muscle leads. Whoa.
oh, there's a beagle and a toddler over there.
We got a tail wag. I also love to do compressions up the tail because it's an extension of their spine, and I think it's so important to give them the signals down there.
There's Mom.
Oh,
I like seeing him look playful like this, though.
no.
That's good. We're gonna turn off the camera soon so we can. I'm gonna replace those leaves that fell out and give them a little quiet time. But if anybody has any questions for me or Nurse Sam, we're happy to answer them. I bet Burton's mom and dad would be happy to answer questions about his fantastic breed as well.
Yes.
Because he's such a special guy. Sam, anything else you want to add before I sign off for us?
I don't think so.
Okay. All right, guys. Well, thanks for watching. And give this guy a big virtual hug because he loves him. All right. Have a good day and a good weekend.
Bye.